Hello, my name is Zachary Cook. I'll be your nurse today. Today we're going to do a head-to-toe assessment on you. Is that okay?
Yes.
Alright, so we're going to be inspecting your hair, your skin, your heart, your lungs, your extremities, your abdomen. Do you have any questions before we begin? Alright, so what I'm going to do is I'm going to start head to toe and we'll go through it that way. I want to let you know that I've already washed my hands, and so we're ready to begin. Can you tell me your name and date of birth?
Rachel Cook, 7/24/94.
Good. And where are you today?
The clinic.
The clinic, okay. Do you know who the president is?
Donald Trump.
Alright. And what's today's date?
Monday, July 27th, 2020.
Alright. So you're alert to person, place, and time. So that's good. Alright, so now we're going to start from head down, and we're going to assess you. Do you have any questions? Alright, so if you lean your head down towards me, and I'm going to feel for lesions or bumps. Good. Good. Alright, you can look back up at me. So your scalp is intact, you have no presence of lesions or bumps. Now I'm going to check your ears. If you would put your hair behind your ears. Good. So your ears are symmetrical. They're good color, no lesions. You do have piercings in both ears. Alright. Good. Your skin is intact. You're warm to the touch, and your skin tone is appropriate for ethnicity with no pallor, no jaundice, no cyanosis. Alright, so next I'm going to check your eyes. If you would, stare at the wall in front of me, and I'm going to shine a light in each one of your eyes one at a time. Okay? So if you stare at the wall. Good. Alright. And if you look straight at the wall again. Good. Alright. If you would look at the tip of my pen and just follow it with your eyes. Good. Alright, so your pupils, they're at 5 millimeters. They're round, they're equal, they're reactive to light with accommodation. So that's good. Alright, so next I'm going to inspect your mouth. If you could open your mouth for me. Good. Can you move your tongue side to side and stick it out at me? Good. Alright, so your mouth is intact, your mucosa is wet, there's no lesions, no bumps that I can see, your teeth are straight, so good. Alright, so next I'm going to fill your carotid arteries. I'm going to do one at a time. Is that okay? Alright, so I'm going to palpate your carotid. Good. Alright, so your pulse on your carotids, they're at 2+, which is good. And they're at a regular rhythm, so good. Alright, so next, I'm going to assess your upper extremities. Is that okay? Alright. Alright, so your upper extremities, they have a good color for your ethnicity. There is no jaundice, no cyanosis, no lesions. You're warm to the touch. Also on the insides. Good. If you could just relax your arms here. Next, I'm feeling for your radial pulse, bilateral. you're at a 2+ bilaterally with a regular rhythm, so that's good. All right, so next I'm going to listen to your heart. Is that okay? All right, if you'd lay down for me. I'm going to listen in 5 different spots across your chest and down, and I will tell you when I'm about to move. So this is the first spot. I'm listening to the aortic valve. Good. This is the second spot. I'm listening to your pulmonary valve. All right. Your third spot, and this is called Erb's Point. Good. Fourth spot. All right, and fifth spot. Here I'm listening for your apical pulse, and I'm going to listen for a full minute. Good. All right, so your heart rate of your apical pulse was 72 with a regular rhythm and strength. All right, you can sit back up. Swing your legs off the side. All right, so next I'm going to check for skin turgor. What I'm going to do is I'm going to pinch some skin on your clavicle. Is that okay? Good. So your skin snaps right back to place, so you have no tenting, which is good. That means you're well hydrated. All right, so I've examined your head. I've examined your heart. Next, I'm going to examine your lungs. Is that okay? All right, so what I'm going to do, I'm going to listen on each side, all the way down on your front, followed by your back and your side. Whenever I place my stethoscope on you, if you just take in a deep, slow breath and let it out, and then when I move it, you can do it again. All right, are you ready? Good. All right, deep breath. Good. All right. All right, now I'm going to go to your back and do the same thing. All right, deep breath in. Good. Good. All right, so next, if you raise your right arm above your head, I'm going to listen on your side. Deep breath. And again. Good. All right, your lobes are clear, which is good. You have no wheezing, no crackling, so good. Nice, clear lung sounds. All right, so next, I'm going to do your blood pressure. Is that okay? All right. Let's see your arm. Good. Now, if you would just rotate your palm and just relax right here. Alright, your blood pressure was 110/68, so that's good. Alright. So if you would hold my hands, can you grip both of my hands? Good. You have nice strength in both hands bilaterally. I'm going to check your fingers now. Alright, your nails are a nice round shape. No discoloration, no spooning, no clubbing. I'm going to squeeze your fingers slightly. Alright, on your upper extremities, your capillary refill is less than 3 bilaterally, so that's good. Alright, so we've did your head, your heart, your lungs, your upper extremities. Now if you'd lay down, I'm going to do your abdomen. Alright, so I'm going to listen first, and then I'll go through and do it a second time. Is that okay? I'm going to listen in all 4 quadrants for a minute. Okay? Have you gone mute?
No.
Okay. Alright, I'm just going to listen. Good. Good. All right. Good. So your bowel sounds are normal active, which just means they're normal. Next, I'm going to palpate. Do you mind if I look at your skin integrity on your abdomen? Okay. Alright, your skin color is normal for your ethnicities. No presence of lesions, so we're good. I'm going to palpate next. Is that okay?
Mm-hmm.
Alright, so I'm going to do once in each quadrant lightly, and then I'm going to go through again and do deep palpation. Just let me know if you have any pain or tenderness. Any pain?
No.
Good. Any pain? No pain?
No.
Good. Alright, so that was light. This is going to be a little bit deeper. Any pain?
No.
Good.
No.
Okay. Good. Alright. So your abdomen's good. You don't have no presence of masses that I can feel. Normal active bowel sounds. Alright. So next you can sit up. Just sit up right where you are. I'm going to check your lower extremities, okay? Good. So you're warm to the touch. You have no presence of lesion. Your skin tone is normal for your ethnicity. No jaundice, no cyanosis, no pallor. Alright, so next I'm going to press lightly for 5 seconds on your tibia. Good. You have no pretibial edema. Alright, next I'm going to feel for your pedal pulse. You have a good pedal pulse bilaterally. You have a 2+ with a regular rhythm. Alright, so next I'm going to check your range of motion. I'm going to put my hands here. If you push like you're pushing gas pedals, good. Now bring them back to you. Good. So you have good strength and range of motions of your feet. Next I'm going to check your capillary refill in your toes. Good. You have good capillary refill, less than 3 bilaterally in your lower extremities. Alright, so next, if you could stand up for me. Alright. So if you could bend over and touch your toes, I'm going to check your spine. Is there any pain or tenderness?
No.
Good. You can stand up. So your spine is in alignment. You have no presence of kyphosis, lordosis, or scoliosis. So you're properly aligned. All right, you can sit back down. All right, so I've done a whole head-to-toe assessment. I've assessed your scalp, your eyes, your nose, your ears, your mouth. Your trachea is midline. So we've done your trachea, your heart, your lungs, your middle lobe on your right side. We've done your abdomen or lower extremities, your blood pressure, and your eyes. Do you have any questions?
No.
No? Okay. Well, you've had a good exam, and we're done. So I hope you have a good day.
Thank you.